Hi, today I'd like to talk to you about verbal behavior therapy. I'll give you a little history of the therapy itself and how important it is in the intervention of children with autism. According to the Centers of Disease Control and Prevention, 1 in 68 individuals in the United States are diagnosed with autism spectrum disorder. This is currently the fastest growing childhood disorder, and still much is unknown about this exceptionality. Autism spectrum disorder, also known as ASD, is a developmental condition that causes challenges in social interaction, communication, and restricted and repetitive behaviors. There is no such thing as a typical individual with ASD. The severity and symptoms differ in each person. Many of these children suffer from communication deficits of both a verbal and nonverbal nature. Children that have verbal communication are often able to speak, but suffer from a lack of functional language. Communication is an extremely important skill, and therapies are available to assist these children with building their use of language. Applied behavioral analysis is a scientific technique concerned with applying approaches based on the principles of respondent and operant conditioning. B.F. Skinner believed that with operant conditioning, an individual would learn through rewards and punishments for behavior. The conditioning, alongside the practices of ABA, created a therapy known as verbal behavior therapy. These practices encourage individuals with autism to learn language by connecting words with their purpose. Strategies within this therapy have been known to improve communication and functional language for individuals with autism. For children with ASD, or communication deficits, the process of language looks much different than a typically developed child. They develop language skills at a much slower rate, some displaying little expressive and functional language. Many children with autism develop ukulele verbatim repetitions of words within seemingly no apparent communicative purposes. No matter what the language deficit looks like in a child with autism, it is common that they will have difficulty in school and problems in social development. Effective communication skills are extremely important in the success of an individual's education, as well as with their everyday quality of life. Children and individuals with autism spectrum disorder often lack in the ability of applying functional language and other ways of communicating. Lack of communication within a child with autism spectrum disorder can be frustrating for the child and tends to cause behavior issues in and out of the classroom. These behaviors can be challenging for both the student and the educator and often affect the successes of their education. The practices of verbal behavior therapy can be learned by all individuals working with children with ASD and implemented within the classroom. Educators and other professionals working with students and children with ASD need to be equipped with the appropriate strategies and practices tailored to provide intervention for each individual. An educator's knowledge of verbal behavior therapy will guide the way to the development of language within these individuals with autism spectrum disorder. Special education teachers, as well as general education teachers, will be able to use the skills and practices of this therapy to better assist these individuals. Through verbal behavior therapy, these children will become better communicators and will be more successful within their education and daily lives. Verbal behavior implies a social and reciprocal relationship between a speaker and a listener, where the speaker gets access to reinforcement through the behavior of the listener. Skinner believed that learning communication was not just about the behavior itself, but also about the conditions in which the behavior occurred. In his study, Skinner coined the term verbal operant and created names for these four operants: the mand, the tact, the echoic, and intraverbal. These four operants are a part of what we call expressive language. By evaluating these four operants, professionals can target the skills needed to better develop a child's verbal language. The mand is the most critical of all verbal operants and should be the first skill that is mastered. It involves some level of motivation on the part of the individual requesting the demand. A man does not have to involve speech. It can also be taught through augmentative language such as sign language, picture exchange, or with the use of a device. After a child is successful with a man, you should move on to the second operant, tact, which is a label for something that connects with one of our five senses. A tact can be something the child hears, sees, smells, touches, or tastes. Echoic, the third operant, are practiced when the child repeats something that the adult says, or they echo them. The same phrase or word will be echoed back to them. The skill is more difficult with a child with autism because they often have trouble with imitating. Once the skill is mastered, children will begin learning language at a much faster rate. The last verbal operant that Skinner termed is the intraverbal, the skill of answering questions. This skill can be the hardest to develop and should be the last one that is taught. Verbal behavior therapy assesses the abilities of the child's verbal operants as well as their use of receptive skill areas. By assessing the child's skills and weaknesses in verbal operants, along with their listening and responding skills, a professional can best determine how to increase their language and communication skills. Verbal behavior therapy teaches communication and language with the use of this concept. This approach teaches individuals with autism to learn language by connecting words with their purposes. The student learns that these words can help them get them the desired result that they are looking for. Verbal behavior therapy teaches why we use words and how useful words are to a person. Therapy can be taught by a therapist, speech and language pathologist, special education teachers, general education teachers, or any other professional working closely with children with autism. Therapy classifies language into operants and their functions and focuses on the 4 word types Skinner coined. Therapy begins by teaching the child mands as the most basic type of language. For example, the child is taught the word cup can produce the desired result of a cup. As soon as a request is made, the teacher should present the cup to the child while repeating the word. Even if the child is nonverbal, they can be taught this skill simply by pointing to the desired object. This will teach the child that communication produces the desired result. Studies show that verbal behavior therapy has been a positive addition to applied behavior analysis. Language interventions have often produced substantial gains for children with autism. There are many benefits to verbal behavior therapy, and this approach can be used in its own or in conjunction with other teaching methods. The verbal behavior approach for children with autism is based on conceptual logic and the publication of numerous studies on the use of verbal operants with individuals with language disorders. Some of these studies have shown that children with autism, through conditioned automatic reinforcement, were able to produce sounds for the objects that they desired. The functional analysis of behavior has been proven to be an effective strategy for improving the behaviors in children and individuals with autism spectrum disorder. The verbal behavior therapy approach to autism treatment considers language to be a behavior that can be improved through behavior analysis. When correctly applied, behavior analysis can produce positive behavior changes and improve social outcomes. Research and studies are still currently being conducted on this subject, but those that have been conducted have shown that verbal behavior therapy can improve communication in children with autism and their use of functional language. Special education and general education teachers should obtain as much knowledge and information as they can about this topic. Research has suggested that teachers focus on a few essential issues when providing verbal behavior therapy to their students. Command training, interverbal training, and recognizing the role of motivation, communication, and language intervention are important in the success of this therapy. Learning to function in society and within one's own social and independent life is important for all individuals, especially those with autism spectrum disorder. It is up to professionals who work closely with these individuals to provide the skills needed for successful independence. There are proven therapies to assist with this, and individuals trained within these have been successful in achieving the desired outcome. Verbal behavior therapy and applied behavior analysis are proven evidence-based therapies that improve the communication functional skills of individuals with language and communication disorders. With these improved communication skills, individuals are seemingly more successful in their education and everyday social lives. All professionals involved in educating children with autism spectrum disorder should receive proper training in the use of verbal behavior therapy to promote functional language skills. Verbal behavior therapy can easily be implemented in the classroom and within the learning environment. Professionals should educate themselves on verbal operants and the function for each of them. While there is still a growing amount of research being conducted on language-based therapies, there has been a significant growth in individuals when professionals utilized and implemented the verbal operants. The educational achievement of students with autism spectrum disorder depends on those professionals that work closely with them. These students rely greatly on what is taught to them both in and out of the classroom. These learned skills build the foundation for their lives and determine if they will be successfully functioning individuals. Thank you.